Hola y bienvenidos. This is Alex, and this is Spill It, Tea and HIV. We're coming to you from IAS 2019 in the beautiful city of Mexico. And today, we're spilling all the tea on PrEP. So my first guest is Stefan Ku, Dr. Stefan Ku from Taiwan. And Stefan, in Taiwan, you're implementing a different, more innovative approach to PrEP, which is PrEP on demand. Could you tell us a little bit more about how that's worked for the community in Taiwan and what you see as the future for PrEP in that regard?
Hola everybody. I think it's a very unique chance that we started to use on-demand PrEP in Taiwan even before most countries in the world were only recommended daily PrEP. So from our study working with Hornet, we realized that people are actually having this kind of need because people are saying that they don't really have that frequent sex. So they don't want to take daily pills. So on-demand PrEP would be a very convenient way for them to couple with their sex life. So we realized that people had the need, so we need to build out the infrastructure, for example, really informative educational clips, and also to facilitate our case manager or PrEP navigator to teach the community to use that. I think it will be a little bit difficult at the first because people are kind of confused about the regimen or the dosing schedule, and it can be really, really confusing. People need to plan their sex, and also they need to be able to remember the after doses. So I think education will be very, very important, especially in countries where daily PrEP will be already very common. But I think eventually we're going back to the community, the users' need, and since people are really needing it, so we probably can find those people who are perfectly using daily or they're perfectly using on demand. They may switch from either regimen. So as a healthcare provider, we just need to make the infrastructure more friendly. Yeah.
Great, thanks so much, Stefan. I think that the innovation of PrEP on demand really we can learn how to meet the needs of the user to best see the success of that strategy. So from Taiwan, we're going to Brazil. And Brazil has recently, in the last couple of years, had PrEP implemented through their public health system. And Tiago is going to tell us a little bit more about what the issues you've encountered, what the successes are, and where you see PrEP going for Brazil in the future, if it'll be in the system or out of the system, and what might work best.
Hola a todos. So we have PrEP in Brazil for everybody who is in need, for all genders and all sexual orientations, since January last year. And we have currently 15,000 people receiving PrEP in the country, and we have services in all 27 states because Brazil is a continental country. And our challenge now is to reach the most vulnerable people, like Black, MSM, peripheric people from the cities, because what we see now is that mostly more like educated people and people with information are reaching the service. But above all, we have lots of people, 15,000 people, it's a lot. And also within the system, we have the PrEP implementation project. That is a project to kind of supervise the implementation of PrEP in the public health system. So we are collecting data on STI and drug levels, so to monitor this implementation.
Great, thanks so much, Thiago. And from Brazil, we head over to Spain. And so Spain it sort of falls into the category of more Western European, financially rich country, but yet PrEP hasn't been implemented. So Carlos here will help us better understand what is happening with PrEP in Spain and what might be some of the future things we can expect.
Yeah, exactly. So we don't have PrEP in Spain already, and actually we are ending our small implementation study, which started 1 year ago. It's finishing in following next weeks, and now we have decided from the government to implement PrEP in Spain. So I think we have two main challenges. The first one is, after these 3 years of not showing very in favor of PrEP in Spain, we have to convince people and health professionals that PrEP is reliable, because this seem not to be clear. And the second one is to make PrEP not only available but also accessible. So we have to figure out which are the best implementation models in Spain, because the epidemic is very concentrated into the bigger cities. So and there we have community-based resources, but this is not the case in other parts of Spain. So we have to figure out which are the models needed in the different contexts in Spain.
Great. Thanks so much. And I guess my last question, and I'll direct this to you, Tiago, is we're talking a lot about advancements in PrEP, new strategies for PrEP, and so one of those is injectable PrEP. And what are you experiencing around injectable PrEP in terms of its success or people's reaction to utilizing it?
Well, currently in my institution in Brazil, we have a clinical trial with cabotegravir with HPTN network, and the acceptability is very high. Many young people were included. Many young gay guys were included in the study, and we hope that it's effective, because it's still a phase 3 clinical trial. And the idea is to offer for those with problems with adherence, so especially young guys and transgender women. So for my perspective, in our site, we have 200 people receiving cabotegravir, and mostly below 24 years old. And I think, I don't remember exactly, but 15% transgender women. So it's very interesting, and we really hope that it's effective and we can have it like as alternative for Truvada very soon.
Great. So I'm Alex from Hornet. This has been Spill It, Tea and HIV, and our topic has been PrEP today, and there really are lots of advancements recently in PrEP, many more in the pipeline, and they also underline the need for support and access around PrEP for it to be successful for our community. So we hope that you will join us again, and thanks so much.